Hello, hello, Mr.
Mm, yes.
Uh,
Hmm?
you also slept or no?
No,
No?
no.
What you did?
Call one of my friends. I like her very much.
Uh,
Yeah, I told her pray. All who I know will pray for you.
thank you.
Sharing is not acting. We don't want.
Kim, sharing I shared now.
No. Maybe because my internet connection is very slow, as turtle.
Mm-hmm. Turtle.
Is no cannot download any video, cannot, but okay, I can it's okay that calling is okay.
Mm-hmm. At least we can.
mm.
Okay, so we will start with uh,
You push your face and
yeah,
talk
done,
or listen.
done, done.
uh,
Mhm.
okay.
Okay,
Or calling from, okay, we stopped at which page? Gangrene.
Cas Casino, do you finish? We will start from Genghis.
Gangrene. Mm.
78-year-old man with black discoloration of his toe.
Mm. What's the pathology?
This is dry gangrene.
What are types of cell death?
Cell death, apoptosis, and necrosis.
Difference
Apop
between them?
okay. Uh, Necrosis is a pathological type of cell death where there will be cell size enlarged, cellular content undergo enzymatic digestion, and cell membrane disrupts, and nucleus undergo karyotypnosis, karyohexis, karyolysis, and always there will be adjacent inflammation, and it is always a pathological form of cell death. And apoptosis, cell reduce in size, cell membrane remain intact, and cellular content remains intact, may undergo uh, release of apoptotic body, and nucleus undergo fragmentation and formation of nucleosome, and there is no adjacent inflammation, and mostly it is a physiological process.
Mm-hmm. Understand the inflammation frequent for necrosis and no for apoptosis. Mention types of gangrene, dry and wet gangrene. Difference between?
Dry gangrene occurs due to arterial occlusion. It occurs in the limb, so the affected organ becomes dry, shrunken, and black. And due to limited blood supply, there will be limited putrefaction and presence of clear line of demarcation between healthy and gangrenous part. And bacteria fail to survive, and prognosis is usually better because little septicemia. And wet gangrene, it occurs due to venous obstruction. It occurs mainly in the bowel, and affected part become moist, swollen, soft, rotten, and there is marked putrefaction, and No clear line of demarcation. No clear line of demarcation. Numerous bacteria present, and prognosis usually poor because of profound toxemia.
Mm. Dry gangrene في اللمب, arterial occlusion, organ dry, shrunken, والpetrifaction limited, والbacteria because limited and bacteria fail to survive. There is line of demarcation and separation, and it's better prognosis due to little septicemia. With gangrene, more common in ball due to infection of venous obstruction, moist organ, moist soft swollen, a marked putrefaction, numerous bacteria, no clear-cut line of demarcation, generally poor due to profound toxemia. Gangrene surrounding area show redness. What's the pathological process? Active.
It is due to hydroxyl vasodilation.
Yes, post-hypoxia, vasodilatation. What are the pathological cells present in aceroma?
There
Pathological
will be
cells.
foam cell, macrophage, and lymphocyte. Macrophage and lymphocyte.
Pathology of pathology of clubbing.
Increase vascular endothelial growth factor. Increase of vascular endothelial growth factor. Vascular endothelial growth factor leads to increased vascular permeability and connective tissue changes.
Increase vascular permeability and connective tissue changes. Okay.
Apart
Apart
from
from hypertension,
hypertension,
يعني
diabetic, and male sex, what are other three major
تعالوا
risk factors for atherosclerosis? One is smoking, family
estrogen,
history, increased age, and hyperlipidemia.
hyperlipidemia. Which size and the type of vessels are
Large and
affected
medium.
by acid?
Large and medium.
Patient shows X-ray with pleural plaque. What are pleural plaque?
Well circumscribed plaque of dense collagen that are often calcified.
What is their significance?
It increase significance of mesothelioma and bronchogenic carcinoma.
Okay. What is their significance in increased risk of mesothelioma and bronchogenic carcinoma? Mention classification of lung cancer: small cell, non-small cell.
Non-small cell
Non-small
has
cells.
squamous, large, and
Mm.
adeno, and it is SLAM.
Arrange
Squamous, large, adenocarcinoma, and small.
is a single bedside test to detect lung cancer.
Sputum for cytology.
He presented with metastasis. How can we differentiate the origin of tissue origin?
Immunohistochemistry.
If the tumor is epidermal growth factor positive,
Imatinib.
chemotherapeutic agent
Tyrosine kinase
is which
inhibitor.
type of
Imatinib.
tyrosine kinase inhibitor like imatinib. Which type of lung cancer respond to tyrosine kinase?
Small cell.
Mm. Small cell treatment of other types of lung cancer,
Uh,
BDL1,
PDL1 and 2 inhibitor. Program cell death protein 1 2. Treatment of other types of lung cancer. Mention types of necrosis.
types of
Okay.
necrosis. Okay,
PDLL, treatment of
easy. What
other lung cancer. PDL1 and PDL2 inhibitor. Okay. PDL1 and PDL2 inhibitor. Program
a
cell death protein.
small cell
Program cell death. Hmm?
tyrosine kinase inhibitor, a small cell lung cancer, a tyrosine kinase inhibitor. Other types, programmed cell death protein inhibitor, protein 1 and 2 inhibitor, BDL1 and 2 inhibitor. Programmed cell death protein.
protein
Programmed cell
inhibitor
death
1 and 2.
protein.
But how it is PDL?
Okay.
Program cell
Mm.
death, I don't know. Okay. Program cell death protein inhibitor, CDL1 and 2.
Okay,
Mhm.
what is adenocarcinoma?
It is a malignant form of adenocarcinoma. It is a
Mm-hmm.
malignant form of
Adenocarcinoma.
tumor which arises from the epithelium and takes the glandular pattern.
It takes glandular pattern. And tumor arise from epithelial origin. Takes glandular pattern. Okay. Carotid.
Uh-huh.
Mm.
Left side, left side. You have seen one side of the page, another side. Ah, say
No,
ah,
you,
ah,
no.
say ah. What is
This,
emphysema?
uh,
Ah,
that is emphysema.
it is
That is
it is it is a it is a permanent dilatation of the airspace distal to the terminal bronchiole with the destruction of the alveoli without scarring and destruction of the lung parenchyma with loss of their elasticity.
yes. I like this. Cause of emphysema.
Cause of emphysema alpha 1 antitrypsin deficiency.
Is alpha 1 antitrypsin deficiency. What's paraneoplastic syndrome?
It is a symptom complex that occurs in a cancer-bearing patient that cannot be explained either by local or distant spread of the tumor or by elaboration of the hormones indigenous to the tissue of its origin of the tumor.
Hormone related to lung cancer, small cell.
Small cell is ACTH and ADH. Small cell is ACTH and ADH, and squamous cell is PTH-related peptide, causing hypercalcemia.
Mm. TNF.
Pro-inflammatory cytokine, which is produced by the macrophage in response to acute inflammation, which increases the range of the temperature and it has anti-tumor effect.
Significance of BDGFRA.
This gene gives the signal to produce protein like platelet-derived growth factor receptor alpha.
Mm. Is a part of receptors of tyrosine kinase family. What is fish?
It stands for fluorescent in situ hybridization, is a kind of cytogenic technique which uses fluorescent probes binding part of the chromosome to show a high degree of sequence complementary. Fluorescence microscopy can be used to find out whether the fluorescent probe bound to the chromosome. Okay, now carotid. 60-year-old uh, female patient. That one no need. Patient
Oh,
present at the
yes,
outpatient clinic with unilateral form facial swelling in raising the right earlobe. Facial nerve examination was normal. Mm-hmm.
most probable diagnosis.
Pleomorphic adenoma. No, no,
Benign
it is
parotid
benign,
swelling.
benign parotid swelling.
Most common is benign tumor.
Pleomorphic adenoma.
Bilium differential diagnosis of unilateral parotid swelling.
Duct obstruction, salivary duct calculus, external duct compression, neoplastic, the benign or malignant, and infective mumps or otitis.
Yes, yes. What is the meaning of pleomorphic
Variety
variation?
of
Pleo.
variety of size and cell of the shape. Okay, okay. Pleomorphism means variety of size, shape, and stain of the cells or their nuclei. Variety of size and shape of the cell, size and shape, stain of the cell or their nuclei.
Mm. Describe pleomorphic adenoma appearance.
The variation of it reflects the stromal epithelial and myoepithelial cells, something else like that. Benign tumor that consists mixture of ductal. Okay, a mixture of it is a mixture of the ductal. It is a mixture of the epithelial, myoepithelial, ductal, epithelial or myoepithelial. Yes, it is a mixture of ductal, epithelial, and myoepithelial cell, and therefore they show both epithelial and mesenchymal differentiation. Yes, okay. Okay, okay. It is a mixture of both ductal, epithelial, and myoepithelial cell. Therefore, it shows both epithelial and mesenchymal differentiation.
Mhm. Can pleomorphic adenoma turn malignant?
In 5% people, in they can turn into malignant called carcinoma X pleomorphic adenoma.
Mhm. How does it occur?
Uh, it occurs in long-standing pleomorphic adenoma with average age recurrence after 20 years, and uncertain etiology, suppose exposure to radiation and accumulation of genetic instability.
With average age of recurrence after 20 years, unclear etiological factors. Factors but has some series like exposure to radiation, combination of genetic instability. Okay. What is the most common malignant parotid tumor?
Mucoepidermoid carcinoma.
Mm, yes. From your examination, what chemical signs would make you suspect malignant transformation in parotid tumor? Mm,
One second.
mm.
Uh,
Clinically,
from
how to suspect
examination.
such.
Okay, okay, okay. Facial nerve affection rapidly increase in size, fixed with underlying structure and overlying skin, with ulcer and presence or associated with lymph node.
What are the characters of malignant neoplasm in general?
A rapid increase in size and anaplasia and invade surrounding tissue and metastasize to distant tissue.
Mm. Traveling can and is a two listen. Okay, okay. Simple test to help differentiation.
Definitely.
What are the cytological features that raise concern of malignancy?
Uh, abnormal mitosis, increased number of mitosis, hyperchromatism, lack of differentiation, aplasia, and presence of hemorrhage and necrotic tissue necrosis. Increase
Uh,
necrosis or hemorrhage, increase atypical mitosis, atypical pleomorphic cell, and hyperchromatism, increase nuclear cytoplasmic ratio, increase number of mitotic. Okay.
hmm. What is the main difference between cytology and histology?
Cytology is the cellular structure, and cytology is the study of the cellular structure and their function, and histology is the study of tissue under microscope. Cytology is
Advantage
cheap,
and disadvantage.
simple, quick, and less invasive. Quick, simple, easy, and cheap, quick, cheap, easy, simple. less invasive, but it cannot give the proper information about the tissue architecture and it can give false negative result. And histology is more reliable, avoid unnecessary excisional biopsy, give information about the tissue architecture and can differentiate between follicular adenoma and carcinoma. And disadvantage is it is a invasive procedure, operator dependent and expensive.
Mm. Interpret the following if in AC lung drainage joint cell is lymphocyte with necrotic material,
Mycobacterium, TB, granuloma,
round pigment cell with absolute cell,
brown pigmented cell, epithelial cell, it is malignant melanoma. Red Steinberg cell is
mm.
Hodgkin lymphoma. FNA has a sensitivity of, okay, sensitivity is the ability of the test to correctly identify a individual as diseased. Sensitivity as disease. Highly sensitivity, the low number of the false negative result, and specificity, the ability of the test to correctly identify the individuals as disease free, and high specificity, low number of false positive result when applied to a test group of population.
Mm. How can you differentiate between carcinoma and lymphoma?
By immunohistochemistry. It is a method of
What's
recognizing
immunohistochemistry?
specific antigen based on antigen antibody recognition. The antibodies are usually linked to an enzyme or fluorescent dye, and when the antibodies are bind to the antigen, the enzyme or dye are activated, and the antigen can be seen under the microscope.
How to rule
Um,
out malignant transformation
Interpretably by
intra
proton section done
how does it
while doing
mm,
FNAC needle stick, the wound should be allowed to be bleed under the running water and wash with water and soap. Assess risk of incident risk, then assess source patient, take history. If he has possibility of any blood-borne infection, take a blood sample from the patient with if high risk after consent. I would file an incident report and ask the occupational health for advice and documentation.
okay. While doing a fine needle aspiration cytology needle stick injury was encountered, what would you do?
Huh. Just I told.
Mm.
Don't sleep.
You told the documentation.
Yes,
Okay. What
don't
are
sleep.
the post-operative complies? Not sleep by the mean,
Hmm.
sleep by your thoughts. Okay.
Hmm.
What are the post-operative complications of parosidectomy?
Okay, postoperative complication of parathyroidectomy, it can cause facial nerve affection, Fraze syndrome, salivary fistula, and greater auricular nerve damage, which may cause numbness to the ear lobule and angle of the mandible.
What is Frey syndrome?
It is post paroidectomy phenomena where there will be re-innervation of the postganglionic fiber to the sweat gland and the cutaneous blood supply, which will cause respiratory sweating and facial flushing.
Due to innervation, boosting ink fibers to sweat gland and cutaneous blood vessel. 10 years after surgery, the patient presented with a neck swelling. What's your differential
Car-
diagnosis?
Carotid body tumor, lymphoma, and recurrence with metastasis.
Who is metastasis? Okay. What is the relation between breast cancer and the pleomorphic adenoma?
The breast is considered as modified sweat gland, and they have similar some morphological feature and functional features, and they also share some genes like breast cancer and salivary gland expression gene. and BRCA1 and BRCA2.
Hmm. Or how would you investigate a clinically suspected pleomorphic adenoma?
By FNSC or
And
through cut biopsy.
advantage and disadvantage.
FNSC,
Functional, functional.
FNSC is cost-effective, simple, quick result, and less invasive. And disadvantage, it can give false result, and it can give, and it does not give the full architecture of the tissue. And true cut, avoid unnecessary excisional biopsy. It is more reliable and relatively easy, and disadvantage it is more invasive than FNC, expensive, and chance of scar formation. What test can be done with
Hmm.
FNC? We can do immunohistochemistry and check receptor estrogen and estrogen, progesterone, and HER2. Also, fish. We can do fish also here. This is breast. So no, this is not breast. Hmm. When cytology is to be considered inconclusive, when poor technique, inadequate sample mixed with blood or inflammatory cell, and mislabeled. When FNC sample is considered to be adequate, contain minimum of free preserved cell group per slide group, and not fixation artifact in 10 smear. Not fixation artifact in 10 smear. What's the meaning of pleomorphic? Describe the preliminary. Okay. After 10 years, okay. If the metastasis orders the carotid artery, erodes the carotid artery, why does not? Okay. Because of the high blood flow in the carotid artery, because of the high blood flow in the carotid artery, an arterial wall may be necrotic, and the artery loses its ability to undergo vasoconstriction in response to the injury. What is carotid blowout syndrome? Life-threatening emergency due to necrosis of the arterial wall due to a direct tumor invasion. Life-threatening carotid blowout syndrome. Life-threatening emergency due to necrosis of the arterial wall. Life-threatening emergency due to necrosis of the arterial wall due to direct tumor invasion. Can you define a metastasis survival and growth of a cell at a site distant from the from its primary site of origin? Five steps by which metastasis occur: direct or continuous extension, penetration into the lymphatics, blood vessel, or body cavity, then transport of the tumor cell into the circulation, then arrest in the capillary bed as of its secondary site, and growth of the disseminated tumor cell into the secondary site.
Again.
Types of spread. Again, direct or continuous,
Hmm.
direct or continuous extension, then invade into the lymphatics, blood vessel, or body cavity, then transport of the tumor into the circulation, and arrest in the capillary bed, which will be regarded as their secondary site, and then growth of the tumor in the secondary site.
Hmm. The main routes of spread of pregnancy.
Direct and distant. Direct infusion and distant. Distant by lymphatics, lymphatics like carcinoma, hematogenous sarcoma, and transceromic direct body cavity or the peritoneal along the body cavity to peritoneal cavity, and others like perineural invasion, like facial nerve, in parotid pleomorphic adenocarcinoma.
What are the mechanisms by which cancer cell promote lymphatic spread?
Okay, next. You can go.
Eh? Eh?
Okay, okay. I thought you will escape this one. Cancer cell produces vascular endothelial growth factor. which causes lymph angiogenesis in the primary site and in the central and lymph node. What happened?
Yeah.
Hmm? Hello?
Mm.
Skin gone.
Eh?
Where is the skin gone?
Hello. I cannot hear
Hello?
you well. Yes, I can hear.
Suddenly my skin gone from here. That's why.
Ah, yes.
And moderators to the body's response in gram-negative septicemia, anti-tumor effect, and similar effect like interleukin 1. What is the rule of TNF? What is the rule in inflammatory bowel disease? TNF direct epithelial. TNF causes increase epithelial tile jackson permeability, so increase the flux of the luminal bacteria component and activation of the innate and adaptive response. Which drugs antagonize TNF? Which drug antagonize TNF, or what drug we use? That is infliximab, cetrolizumab, Netflix, and adalimumab. What is the? It is a monoclonal immunoglobulin G antibody to TNF alpha, and it blocks the inflammatory process. When to use? Used mainly steroid refractory to ulcerative colitis and treatment of extraintestinal manifestation. Now this is cobblestone, and the left one is the cobblestone, and this one maybe what they are trying to show cobblestone appearance and creeping mesenteric fat and so on. You have to be familiar with them. Peptic ulcer. Different peptic ulcer, breach of continuity of the skin and epithelium, breach of continuity of the skin and the mucous membrane due to sloughing out of the inflammatory necrotic tissue. Risk factor for the POD, H. pylori, NSAID, smoking. NSAID causes topical irritant effect on the epithelium and impairment of the barrier properties of the mucosa, suppression of the gastric prostaglandin synthesis and inhibit of the COX-1 and reduction of the gastric mucosal blood flow, interference with the repair of the superficial injury. It is a gram-negative microaerophilic spiral bacteria which is found in the stomach, and we will do a CLO test, Campylobacter organism test. How it is done? A gastric mucosal biopsy is taken during the gastroscopy and is placed in medium containing urea and indicators such as phenol red. Urease produced by H. pylori convert the urea into ammonia, which increase the pH and change the color from yellow to red. And how H. pylori managed to survive by producing urease, which convert the urea to ammonia, which increase the pH. Other tests, urea and test for stool antigen, urea breath test and test for stool antigen. How H. pylori can colonize in the stomach by flagella, which allow the bacteria to be motile inside the viscus, and urease, which convert the ammonia to which convert ammonia, which generate ammonia from the urea, and thus elevate the local gastric pH around the organism, and thus protect the bacteria from acidic pH, and addition, which enhance bacteria to adhere the surface fabular cell, and toxins such as CAG-A, CAG-A, thus may involve the ulceration. And okay, how does H. pylori induce gastritis? By producing ammonia? Hmm? Yeah, yeah, ammonia. Yes, yes. Ammonia, urease and phospholipase protease and ammonia, which causes damage of the gastric mucosa and chronic irritation and causes inflammation. Simple simple columnar with goblet cell. Simple columnar with goblet cell H. pylori induce adenocarcinoma and myeloma. Other autoimmune disease is Hashimoto's thyroiditis. We give full dose of PPI, metronidazole, and clarithromycin, or full dose of PPI, amoxicillin, and clarithromycin 500 milligram. H. pylori bind PPI bind with hydrogen potassium ATPase and reduce and secretion of the hydrogen ion, which combines with the chloride in the stomach to form lumen. Okay, activates pepsinogen. It activates pepsinogen to pepsin, which help in proteolysis and provide optimal pH for the action of the pepsin. It stimulates the small intestine to release secretin and CCK, enhance absorption of the calcium and iron in the small intestine, and antimicrobial. Yes, yes, yes. It stimulate gastrin secretion, and this gastrin stimulate HCl secretion. HCl causes chronic irritation and mucosal eruption. It will cause bleeding. H. pylori. H. pylori increase hypercalcemia. Hypercalcemia. Malignancy, renal failure, hyperparathyroidism, NPTH, adenoma. Okay. Benign epithelial neoplasm takes the glandular pattern. Hmm. It is a pathological laboratory procedure to perform rapid microscopic analysis of a specimen. It takes a week to embed. Hmm. 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 Excision. One gland, one gland parathyroid adenoma, and involution of the other gland. Mainly chip cell hyperplasia with few occipital cells surrounded by thyroid tissue separated by septa or fibrous capsule. It is mainly by chip cell with few islets of occipital cell surrounded by non-neoplastic thyroid tissue, which is separated by fibrous septa, and difference parathyroid hyperplasia composed of chip cell hyperplasia with clear water clear cell. Primary hyperparathyroidism, primary hyperparathyroidism by excision, secondary hyperparathyroidism by dialysis, and tertiary hyperparathyroidism. First, it is usually happens after post renal transplant. For first 12 months, we try to manage with conservative management. If no improvement, then surgery. Hypercalcemia, calcium. Huh? Huh. Yeah. Multiple polyps of different size and shape. Most probable diagnosis, FAB, other than we can see in the stomach and the duodenum. It is a autosomal dominant condition that due to loss of APC tumor suppressor gene in long arm of the chromosome 5, leading to development of hundreds of tubular adenoma with 100% risk of cancer at the age of 40. What it, it encodes a factor that negatively regulates the WNT pathway. Lynch, Lynch syndrome, Pitt-Seeger syndrome, Cowden syndrome. Classification of polyp, polyp neoplastic, non-neoplastic. Neoplastic, villus, tubulus, tubulovillus. And non-neoplastic, hematoma, polyp, and metaplastic. Pitt-Seeger syndrome. You became bored with me, right? You became bored. You were feeling boring with me now. Okay. It is a focal or multifocal malformation composed of haphazardly arrangements of different amount of tissue that are normally present in the organ. Example, Pitt-Seeger syndrome. Uh, okay, malignant transformation, intestinal obstruction, bleeding, intussusception, ulceration, and electrolyte imbalance like hypocalcemia. Malignant transformation, intestinal obstruction, intussusception, ulceration, and bleeding, and electrolytes disturbance, hypokalemia. And how malignant transformation, if it is the type is villus, 40% chance, adenoma size less than 1%, 5% chance, and less than 1 centimeter, 5% chance, and size 2 centimeter, 20% chance, and degree of dysplasia. um, mm, Describe the sequence of events of malignant transformation of the adenoma due to hyperplasia due to loss of APC tumor suppressor gene, dysplasia due to KRAS proto-oncogene mutation, and adenocarcinoma due to loss of P53 tumor suppressor gene. Hyperplasia, dysplasia, and adenocarcinoma. First, hyperplasia due to loss of APC tumor suppressor gene. Then from hyperplasia, it will go dysplasia by KRAS proto-oncogene mutation, and then again P53 tumor suppressor gene suppression will cause adenocarcinoma. Proto-oncogene is the normal cellular gene which produce proto-oncogene is the normal cellular gene whose products promote cell proliferation. PPP. Proto-oncogene is the normal cellular gene which products promote proliferation of the cell, and oncogene is the overexpressed and mutated and overexpressed variation of the proto-oncogene that functions autonomously, and tumor suppressor gene, normal gene whose absence can lead to development of the cancer, like P53 and APC. Function of KRAS. KRAS gene provides instruction for making the protein called KRAS. Then this protein transmit signals from the outside of the cell to the cell to the nucleus of the cell, and to the nucleus it gives instruction for cell proliferation and differentiation. And APC, no, then P53 is a tumor suppressor gene. So it arrests the growth of a cell at G1 phase. It causes DNA repair and it causes apoptosis. P53 arrests the growth of a cell at G1 phase. Thus, it prevents the replication of a damaged DNA, and they causes DNA repair. So, damage repair and apoptosis. Gardner syndrome is a variant of FAP. Gardner syndrome is a variant of FAP characterized by mandibular osteoma, sebaceous cyst, desmoid tumor, and gastric fundal polyp. Mandibular osteoma, sebaceous cyst, mandibular osteoma, sebaceous cyst, dermoid tumor, mandibular osteoma, mandibular osteoma, sebaceous cyst, mandibular osteoma, sebaceous cyst, mandibular osteoma, sebaceous cyst, desmoid tumor, and gastric fundal polyp. Other FFP is Tarcot syndrome. What are the different treatment modalities of lady? Subtotal colectomy with ileorectal anastomosis or ileostomy, and panfructocolectomy with either end ileostomy or subtotal colectomy with ileorectal anastomosis or panfructocolectomy at the age of 25 or younger. Genetic counseling. Where is that one? Oh, okay, now. Okay. Which lifestyle modification you will high fiber diet, decrease fat intake, smoking cessation, alcohol cessation. Screening by the age of 12. She is screening by the age of 12 and prophylactic near total colectomy by the no. Uh-huh. Yeah. First, we'll advise for the genetic counseling and screening. Then, we'll advise for annual sigmoidoscopy starting from the age of 13 up to 20. Then, from the 20, we'll start annual colonoscopy. Presence of ectopic uterine tissue other than uterus. No, colon cancer. How can you stage colorectal cancer by Duke's classification and TNM? Oh, TNM also by Duke's staging and TNM. TNM, Duke's staging and TNM. What is the stage as it invades the muscularis propria? It is B1. B1, no lymph node or distant metastasis. Which is more important in clinical use? TNM and modified Duke's staging system. Which is more important in clinical use, TNM and modified Duke's staging system. A, B1, B2, C. Uh, we have to explain this on whole. Okay, A, tumor penetrate into the mucosa. Okay, we know this one actually. A, tumor penetrate the mucosa of the bowel wall, but no further. B1, tumor penetrate the muscle, but not through the tumor penetrate the tumor penetrate into the mucosa of the bowel, but not up to the muscle. And B1, tumor penetrate the muscularis propria. Uh, mm, mm, B2, tumor penetrate into the through the muscularis propria of the bowel wall. C1, tumor penetrate into but not through the muscularis propria of the wall, and there is lymph node. involvement, and C2 penetrate through the muscularis propria, and there is pathology representative of colon cancer with the lymph nodes. D. Distant tumor, which has spread beyond the continuity of the lymph node and the distal nodes like lung, liver. What is the age of screening of the colorectal carcinoma? Between 50 to 59. Between 50 to 59. What is the fecal immunochemical test? FIT. FIT detects the small amount of blood in the stool sample using antibodies specific to human hemoglobin. Okay. What is FIT? FIT detects the small amount of blood stool. What is the fecal immunochemical test? It detects the small amount of blood in the stool sample using the antibodies specific to human hemoglobin. FIT screening is quantitative, and the threshold for normal result for the set locally. So, okay. What is the hemorrhoid? Swollen and bulging of the veins and the lower swollen and bulging veins in the lower rectum and anus. The anal cushion functions normally when they are fixed to their proper site within the anal canal by the fibromuscular ligament, which is the annular ligament of the longitudinal longitudinal layer of the muscularis propria from the rectum. But when these submucosal fibers are fragments as a by prolonged and repeated downward stress related to the straining and the defecation. The anal cushion are no longer restraining from engorging excessively, and the blood may result bleeding and prolapse. Okay, we'll say it like our model, our patient. What is the pathogen? Yeah, we can say it in our problem. What is the pathogenesis of the thrombospile? Um, Acute thrombosis result from the sudden acute thrombosis result from sudden raised pressure causing rupture of the vascular plexus, leading to clot formation in the anal bulge. Okay. Define melanosis coli. It is a disorder of the it is a disorder of the pigmentation of the wall of the colon, often identified during colonoscopy. It is benign and may have no significant significant may have no significant correlation with the disease associated with chronic laxative use. How does coronary artery get thrombosed due to coronary artery atherosclerosis? Okay, this is our answer. Risk factor, non-modifiable, modifiable, genetic, non-modifiable genetic abnormality, family history, increasing age, male gender, and modifiable hypertension, hyperlipidemia, cigarette smoking, diabetes, and inflammation. What are the common sites of atherosclerotic and their effect? Okay. Large and medium-sized vessel, coronary arteries causes decreased blood supply, causes MI. Cerebral arteries causes cerebrovascular accident. In renal failure. In the lower limb causes limb ischemia. In the blood supply of the small intestine can cause ischemic colitis. Can you define a thrombus? Is a product of coagulation pathway which remains at the same site of its origin. Okay. Which is the concentration of the blood. Okay. What is the mechanism of thrombus formation? Okay. Then thrombus and float difference occurs in the flowing or circulating blood and firmly attached to the blood vessel, friable and dry, pale red and mixed, may show line of Zen, and clot occurs in the standing blood, loosely attached, soft and moist, current jelly appearance, or here red or yellow appearance, no line of design. How does Megadol? Okay, this is prayer time. We can gastric cancer. Can you give some minute, maybe 10 minutes for me? Hmm. Hmm.